Is the RSV vaccine and antibody safe? I'm Dr. Mona Amin, a board-certified pediatrician and mom of two, and we're discussing the RSV vaccine available during pregnancy and the RSV antibody available for infants. Let's get to it. RSV is a common virus that for many causes symptoms similar to a common cold, but for some children, it can lead to lower respiratory tract involvement with conditions like bronchiolitis and pneumonia. It's a leading cause of respiratory infections in young children, especially in infants under 2 years of age. Most children will get RSV by the time that they're 2, but it can be more severe for some children, leading to bronchiolitis and pneumonia. Today we'll cover the RSV vaccine in pregnancy and the antibody for infants, not RSV itself. For details on RSV signs and symptoms and more about the illness, check out my RSV video, perfect as we approach RSV season, whether or not you choose to vaccinate in pregnancy or give the antibody for your infant. Before last year, there were no RSV vaccines or antibody treatments available for the general population in the United States. We have routinely given Synagis or palivizumab. This is an antibody given to protect high-risk infants from severe RSV. This was usually preserved for premature babies born before 35 weeks, infants with certain heart or lung conditions, or babies with weakened immune systems, and given as a monthly injection during RSV season to reduce the risk of hospitalization. The introduction of a vaccine during pregnancy and for all infants has been groundbreaking and a long time coming, as both these options help prevent severe infections and hospitalizations and reduces the risk of RSV-related deaths. There are 4 different RSV vaccines or antibodies available: Abrysvo, RSV, Beyfortus, and Synagis. Abrysvo and RSV are vaccines, whereas Beyfortus and Synagis are antibodies. The 2 that we're going to discuss today are Abrysvo and Beyfortus, as they are regularly available for pregnant people and all infants, respectively. Before I continue, this information is purely educational and is not sponsored by any pharmaceutical company. The goal of this video is to give you information as it stands at the time of debut of this video so you can make an informed decision without misinformation, because there is far too much of that on social media and online, and in order to make an informed decision on vaccines or antibodies, you need a discussion on benefits, which is efficacy, and risk, or side effects, which I will discuss. Let's talk about Abrysvo. Abrysvo is a vaccine option during pregnancy. It is important for pregnant people to consider getting vaccinated against RSV, as the antibodies created by the pregnant person get passed on to the baby through the placenta. Abrysvo is the first vaccine approved for pregnant individuals to prevent RSV-related lower respiratory tract disease, or LRTD, in infants from birth to 6 months. This is incredibly important as well if the baby ends up being premature or ends up having underlying health conditions, as the vaccine helps to reduce the chances of hospitalization and complications for these vulnerable groups. The vaccine is recommended for use between 32 to 36 weeks of pregnancy and is given as a single injection into the muscle like your arm. Pregnant people who are more than 36 weeks and 6 days pregnant should not be vaccinated, as it is unlikely there will be enough time for the antibodies to develop, cross the placenta, and protect the infant. And in this case, Beyfortus for your baby may be a better option, but stay tuned for more about Beyfortus. In most of the continental United States, the recommended months for vaccination are September through January, ideally right before RSV season hits. However, the recommended months may differ in some areas, such as southern Florida, where I am, Alaska, Hawaii, and U.S. territories. For example, in Florida, our RSV season is actually earlier, and so recommendation is shifted earlier. In clinical trials, maternal RSV vaccine reduced the risk of the baby being hospitalized for RSV by 68% and risk of having a healthcare visit for RSV by 57% within 3 months after birth. In the same trial, the RSV vaccine reduced the risk of the baby being hospitalized for RSV by 57% and risk of having a healthcare visit for RSV by 51% within 6 months after birth. The maternal RSV vaccine reduced the risk of severe infant outcomes caused by RSV, including having low oxygen in the blood or the need for mechanical ventilation or admission to an intensive care unit, by 82% within 3 months and by 69% within 6 months after birth. A study published in the New England Journal of Medicine showed a significant reduction in severe RSV-related lower respiratory tract disease, 81.8% within 90 days and 69.4% within 180 days of birth. Protection may go beyond this. However, there is no research data to show if there is protection past the 180 days. The timing of the 2023-2024 RSV season and overall low uptake of maternal RSV vaccine has limited the CDC's ability to estimate maternal RSV vaccine effectiveness during the season with population data outside of clinical studies, but the vaccine will continue to be monitored for effectiveness and safety. The safety of Abrysvo in both maternal and infant participants was assessed in 2 clinical studies involving about 4,000 pregnant individuals who received a single dose of the vaccine. In Study 1, participants were under 49 years old with uncomplicated pregnancies, excluding high-risk cases. A total of 3,682 participants received Abrysvo, while 3,675 received a placebo, or no vaccine. Infants born in the study will be followed for 24 months to monitor safety. The median maternal age was 29 years, and vaccination occurred at a median gestational age of 31 weeks. Most infants were born full term with a median gestational age of 39 weeks. In Study 2, 115 pregnant individuals received Abrysvo, with the median gestational age at vaccination being 30 weeks. Most adverse reactions were mild to moderate, resolving within 2 to 3 days. Severe local reactions were rare, and systemic reactions occurred in 2.3% of participants, similar to the placebo or non-vaccinated group. Another study published in JAMA in July of this year looked at the rates of premature delivery in mothers who received Abrysvo, and it found that there was not an associated risk of premature delivery in mothers who received the vaccine. In Study 1, 16.2% of maternal participants in the Abrysvo group and 15.2% in the placebo group experienced serious adverse events at any point during the study. Within 1 month after vaccination, 4.2% of participants in the Abrysvo group and 3.7% in the placebo group reported serious adverse events. Most of these adverse events were related to pregnancy complications and occurred after the 1 month period post-vaccination. Abrysvo should not be given to anyone who has had an allergic reaction to Abrysvo and to anyone before 32 weeks to reduce the risk of preterm birth. The most commonly reported local and systemic adverse reactions in pregnant individuals in the study were pain at the injection site, headache, muscle pain, and nausea. Preeclampsia, a serious hypertensive disorder, occurred in 1.8% of pregnant individuals who received Abrysvo compared to 1.4% in the placebo group. Infants of Abrysvo recipients also had higher rates of low birth weight and jaundice. The prescribing information for Abrysvo does include a warning about a numerical imbalance in preterm births, 5.7% in the Abrysvo group versus 4.7% in the placebo group. While the data are insufficient to confirm a causal link as both groups, those who got the vaccine and those who didn't, experienced these issues, healthcare providers are advised to administer Abrysvo only between 32 and 36 weeks gestational age to reduce the potential risk of preterm birth. Now we're going to switch gears and discuss Beyfortus, which is the RSV antibody option for infants and young children. Beyfortus, which is also generically called nirsevimab ALIP, is not technically a vaccine but a monoclonal antibody injection that provides protection. A monoclonal antibody injection is a treatment designed to boost your child's immune system by providing it with ready-made antibodies to fight off specific infections like RSV. Unlike vaccines, which train the body to make its own antibodies over time, monoclonal antibodies give immediate protection. It works by targeting and neutralizing the virus before it can cause serious harm. Beyfortus is recommended for all infants younger than 8 months of age born during RSV season or entering their first RSV season. According to the CDC, babies can receive Beyfortus if the mother did not receive an RSV vaccine during pregnancy or if the infant was born within 14 days of maternal RSV vaccination, or in special circumstances where the mother may not have made or transferred antibodies to the baby, or if the pediatrician feels that the infant is at particularly high risk of developing severe RSV. The antibody is also recommended for some children aged 8 through 19 months who are at increased risk of disease and entering their second RSV season. These conditions can include children who were born prematurely and have chronic lung disease, children with severe immunocompromise, children with cystic fibrosis who have severe disease, American Indian and Alaska Native children. Clinical trials show that protection lasts for about 5 months after administration of the antibody. It is important to get the antibody right before peak RSV season, which is during the fall and winter months. This helps to give your child as much protection as possible. This antibody can be given at the same time as other vaccines as well. In most parts of the United States, October to January will be the best time to get this antibody. Beyfortus was developed over 7 years, with the first major clinical trial starting in 2016. 2 major studies were done, and the main goal was to measure the rate of medically attended lower respiratory tract infections like bronchiolitis or pneumonia caused by RSV after 1 dose of Beyfortus. Medically attended means any healthcare visits, including doctor's office visits, urgent care, emergency room trips, and hospitalizations. The studies followed infants for 150 days after a single dose, and Beyfortus was compared against a placebo. 3 groups were studied. Group 1 had healthy full-term and late-term infants born at or after 35 weeks gestation. Group 2 had healthy preterm infants born between 29 and 34 weeks gestation. And Group 3 had infants at higher risk for severe RSV disease, high-risk infants, including preterm infants less than 35 weeks, and those with chronic lung disease or congenital heart disease. I appreciated the study showing diversity not only in gestational age, but underlying medical conditions. The primary goal was to see if Beyfortus reduced the RSV infections in the lower respiratory tract and to check if it reduced hospitalizations. Beyfortus has been shown to be effective in protecting infants against hospitalization for RSV-associated lung infections. Another study published by the New England Journal of Medicine in March of 2022 showed that a single dose of Beyfortus resulted in a 74.5% reduction of lower respiratory tract infections and a protection rate of 62.1% against RSV-related hospitalizations. A study published in the New England Journal of Medicine in July of 2020 evaluated the effectiveness of Beyfortus in preventing RSV infections in preterm infants, showed that the antibody reduced RSV-related infections by 70.1% in the group that received the antibody compared to the group that did not. The most promising data for me for Beyfortus comes from a real-world analysis published by the CDC on March 7th of 2024, estimating its effectiveness in preventing RSV-associated hospitalization among infants in their first RSV season. Conducted at 4 out of 7 sites in the new vaccine surveillance network, the study used a test-negative case control design involving 699 infants under 8 months hospitalized for acute respiratory illness. Among these, 407 or 58% tested positive for RSV, while 292 or 42% tested negative. Only 6 of the 407 case patients who received Beyfortus were RSV positive, compared to 53 out of 292 control patients. Effectiveness was evaluated using regression models adjusted for potential bias, controlling for age, month of illness, enrollment site, and high-risk medical conditions. The analysis found Beyfortus to be 90% effective in preventing RSV-associated hospitalization from October 1st, 2023 to February 29th, 2024, which is such promising data. In clinical studies, the Beyfortus group included 1,998 healthy term and late preterm infants and 572 preterm infants compared to 1,284 who received a placebo. Adverse reactions were reported in 1.2% of infants who received Beyfortus. Most, about 97%, of adverse reactions were mild to moderate in severity, such as injection site reactions, such as pain, swelling, and redness, fever, and irritability in children. Less common effects included rash and mild gastrointestinal symptoms like diarrhea. Rare allergic reactions have also been noted. Many anti-vaccine accounts are latching onto the idea that 12 infants in the study did die. However, please note that these deaths were not directly related to the antibody, as they had underlying medical conditions, and one was even tragically from a car accident. Beyfortus should not be given to anyone who has had an allergic reaction to Beyfortus in the past. If an infant has a clinically significant bleeding disorder, risk and benefit of Beyfortus should be discussed with your child's clinician. To prevent RSV-associated lower respiratory tract infections in infants, it is recommended to get either RSV pre-F or Abrysvo vaccine to the pregnant person, or RSV monoclonal antibody, nirsevimab, ALIP, Beyfortus to the infant. There is no preferential recommendation for using the vaccine during pregnancy or administering RSV monoclonal antibody, Beyfortus, to the infant after birth. No studies have directly compared the two options yet. However, both options have been shown to provide significant protection against RSV-associated lower respiratory tract infection in infants entering their first RSV season. Here are some situations where you might consider Abrysvo. You or your developing baby have underlying medical issues in pregnancy, or your baby will likely be born premature, as this can provide more protection sooner. Beyfortus is not available. You work in healthcare where you are around RSV and want more immediate protection for your baby. On the other hand, you may consider Beyfortus if Abrysvo wasn't available or you didn't get vaccinated in that 32 to 36 week window. You got Abrysvo, but you delivered your baby less than 14 days after receiving the vaccine. You have a healthy pregnancy and a term baby. You or your OB have concerns of preterm delivery and they recommend waiting. You are 32 to 36 weeks pregnant in February or March. The CDC does not currently recommend maternal vaccination outside of this period in most of the United States because vaccinating a pregnant person in February or March for an infant born in April or May will provide that infant limited protection during the RSV season, typically fall and winter. This infant may be better protected by Beyfortus at the start of RSV season. It is my recommendation that either one should be considered to reduce the impact of RSV. As a pediatrician, I have more experience with Beyfortus given it's given to babies, and my practice has given over 5,000 doses, and it has been extremely well tolerated. I also do like the population data and the real-world data that has been available for Beyfortus. So if your clinician gives you both as an option to either get the vaccine in pregnancy or give the antibody to your baby, think about Beyfortus to see if it's right for you. Generally, these options are available through your healthcare providers, but you can also check with your local health department. If you are pregnant and want Abrysvo, speak to your OB or midwife. Otherwise, the hospital will offer Beyfortus if it's before or during RSV season, or you can get it at your pediatrician's office. You can also check out vaccines.gov to see if any pharmacies in your area carry them. Yes, both can be administered with other routine vaccines that you're receiving in pregnancy or vaccines that your baby is receiving as an infant. I highly recommend considering getting this vaccine during pregnancy or the antibody for your baby if you don't get it during pregnancy. Parents might hesitate when considering immunization, but RSV is highly unpredictable. Even healthy full-term babies can experience mild to severe cases of RSV. While severe cases are rare, RSV is the leading cause of hospitalizations in babies under 1, making babies 16 times more likely to be hospitalized with RSV than with the flu. Most babies, 2 and 3, will contract RSV by age 1. 1 in 4 infants hospitalized with RSV may end up in intensive care. Beyfortus and Abrysvo are part of the CDC's recommended immunization schedule and is supported by the AAP and ACOG. And as a pediatrician who has seen the devastating impact of RSV, I'm grateful that there are finally preventative options. Remember that getting these options doesn't mean that your child cannot get RSV, but it can absolutely reduce the risk of getting severe illness. Did you receive the RSV vaccine when you were pregnant? Did your infant receive the antibody before their first RSV season? If you found this helpful, please give it a thumbs up sign, share it, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Comment below with any questions, comments, or personal experiences with the vaccine or the antibody. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.